Good morning, everybody. I thought today I would probably switch gears a little bit and talk about what it's like being an emergency medicine physician in the U.S. When people find out that I'm an ER doc, the first question I always get is, "Oh, what's the craziest thing you've ever seen?" And there's a lot of different ways to kind of categorize that, like, what's the most unexpected, what's the most gory. Clearly everybody's kind of looking for stories about things stuck in places where they shouldn't be, and yes, that happens. But I thought today I would talk about two cases that have really stuck with me over the years. These are going to be a little bit gory and kind of not safe for work, so if you don't want to hear that sort of thing, please just turn off the video now. But both of these cases happened quite a while ago, and I'll just kind of, I guess, talk about each one of them from the perspective of an ER doc. So, we do see a lot of trauma, and, that goes from falls, car accidents, gun violence, stabbing, stuff like that. But one case that has always kind of stuck with me was there was a young guy who was cleaning his gun at home, and had some friends around him, and one of his friends went to kind of look over his shoulder to see what he was doing, and at that very time the guy who was cleaning the gun, I guess, pointed it up and discharged the firearm, and it shot his friend kind of through the bottom of his mouth and out the top of the head. And so obviously this is a severe injury. He was brought in by ambulance, and he was still breathing, still had a heart rate. So one of the kind of principles of medicine is, like, all of your bodily functions that you don't have to think about, like reflexes and breathing and stuff like that, are kind of done at the base of the spinal cord, back here, or base of the brain back here. And so the bullet missed all of those functions, so he still had some of his vital functions left. But by the time he arrived at the hospital, there's kind of brain matter scattered all throughout the bed. He was hemorrhaging from an eye socket, had totally enucleated one of the eyes. So the principles of trauma are airway, breathing, circulation, disability exposure. And so you kind of start going through your checklist when they come in, and clearly he was at risk of losing his airway just with all the trauma. So fortunately we were able to intubate him, and when you're doing that, you're kind of just looking for any little air bubbles, because there's so much blood in the airway. It's going to be hard to kind of see where you're supposed to put the endotracheal tube. But fortunately that went okay. But we were having a lot of difficulty controlling the hemorrhage that was actually coming from an eye socket. So we kind of packed the eye socket with a bunch of gauze, and put like a suction Yankauer in there, and tried to hold pressure as best as we could. So once you see brain matter that's kind of all over the place, that's one of the criteria for stopping resuscitation or calling time of death out in the field. Like if a paramedic goes to a trauma location and they see exposed brain matter in somebody who has no cardiac activity, you can kind of call time of death at the scene, because that's not recoverable. But in this guy who still had a heart rate and was still breathing and stuff like that, you're trying to keep him alive long enough to mainly be able to donate organs. And we kind of did the best we could, but his injuries were just not recoverable. And so I remember talking to family and talking to the friend when all of this stuff happened, and they were just beside themselves, obviously. Just a terrible accident, and a really difficult resuscitation, and it was just a really unfortunate case. And so that's kind of one that's always stuck with me. The other one that I can still remember kind of the faces and everything that happened was there was a young kid, I think he was younger than 6 years old, was playing in his yard, and ball rolled out into the street, and there were cars parked along the side of the street, and so he ran in between two parked cars and out into the road to get his ball. And at that time, another car was kind of going down the street and struck him. And he basically, when paramedics were called, they found that he had no pulse or anything on the scene. And so, these are very, very difficult cases. If you have a traumatic cardiac arrest, the chances of survival are extremely low, because usually it means there was something catastrophic, like a tear in your aorta, or like a complete spinal cord injury where the cord just gets transected. Because it was such a young kid, you kind of throw the entire kitchen sink at them. You're going to try to do everything you can to get them back. So they were brought to the hospital, and we intubated them. We put in bilateral chest tubes, because tension pneumothorax is one of the causes that you try to reverse right away. And so you're cutting into this kid's chest, going in between the rib spaces with a scalpel, and then you kind of use hemostats, which is a metal instrument, to kind of puncture through the chest and stick your finger in the chest cavity, and that hopefully releases any trapped air that's in there that could be impeding the venous return to your heart. And so we put bilateral chest tubes in, and then we still, after that, still didn't get a heart rate back. So luckily, I was working at a place that had trauma surgery, and so they did do a thoracotomy, which was, taking a scalpel and making a huge incision all the way across the chest and spreading the ribs, and kind of looking at the heart and looking at the aorta at bedside to see if there was anything that we could possibly repair. And unfortunately, the child ended up dying. But the thing that always kind of stuck with me was seeing the dad come to the trauma area, and just calling out for his son's name, and after we stopped the resuscitation, just seeing him like lay on top of his son and just kind of scream his name, and it was really, really emotional and really sad. And especially now that I'm a father, and just kind of imagining something like that happening to my kids would just be devastating. And so those are the kind of things that I think stick with ER docs more than stuff that gets stuck up somebody's butt. We all have these cases that just really stick with us, and I bring these up for I guess kind of two reasons. One, just be nice to your healthcare providers. They've seen a lot, they've been through a lot, and so just give them a little bit of grace if maybe they're having a bad day or something. But number two is just knowing that accidental deaths are the leading cause of death for young people in the US, and that kind of encompasses the biggest one actually is accidental poisonings, is how they categorize it, but that's mainly going to be drug overdoses with kind of the opioid epidemic. So that would be the number one. But then you have motor vehicle crashes, which we talked about, and then falls, and then kind of distantly down would be gun violence. So just a couple tips to keep you out of the ER. Please drive safely, especially when you're going through neighborhoods. Just watch out for kids. If you're a parent, make sure you educate your kids to never run out into the street, without holding your hand. In general, they just shouldn't be going out in the street. And then, if you do own guns, just make sure you practice good gun safety at all times. So that's kind of what I wanted to talk about today. Hope you all have a great day. If you have any questions, please send them my way. Happy to chat more. Thanks. Bye.